Well, arthritis of the hand really isn't any different than arthritis and anywhere else in your body. The hands certainly aren't weight-bearing joints. We don't walk on our hands. But it can become very destructive and cause a lot of stiffness, which can severely interfere with our daily activities. Certainly any arthritis is just wearing out of the cartilage between two joint surfaces. In particular in the hand, especially at the base of the thumb, there's arthritis that can develop there. It is more often found in women, and it's been linked to one specific ligament that weakens over time and eventually causes the loss of support of that joint, which causes the joint to shift a little bit or subluxate, which causes abnormal wear and the development of arthritis at the base of the thumb. Which is a very disabling type of arthritis. You don't realize how much you use your thumb until you develop arthritis at the base of your thumb, but it can really affect your grip strength and your pinch strength and can be very disabling. Arthritis of the hand, the actual incidence of it is not known. It is very common. And arthritis can be either caused by disease or it can be a result of trauma. Someone either fractured their finger or actually dislocated the joint. And as a result, as time goes on, they develop arthritis. The signs and symptoms of arthritis of the hand usually begin with pain, stiffness. The individual may notice it when they first get up in the morning that their fingers are real stiff, or after an activity that they've done throughout the day. At the end of the day, maybe even the next day, they may feel some stiffness and some pain, particularly in their joints. They may notice some redness or some swelling in the joints of their hands as well. The diagnosis of arthritis generally is based on clinical symptoms, signs that we may pick up on examination. Certainly an x-ray would be obtained in the office, which would show changes typical of arthritis. And as well, sometimes blood work is done to indicate if there's any inflammatory arthritis, like rheumatoid arthritis. Treatment options for arthritis at the base of the thumb would begin with anti-inflammatories, splinting, in particular a splint that includes the thumb, because you want to mobilize the joint that's causing the pain. Certainly cortisone injections can be helpful, or therapy. There's different modalities that they can do over in therapy to help alleviate the symptoms and improve their range of motion. When all that fails, there are procedures that can be done that are more definitive. In a younger individual, we may consider actually fusing that joint or taking away all the motion within that joint. By taking away the motion at a painful joint, it's not going to hurt anymore because you're not rubbing those abnormal surfaces on each other. In an older individual, we would actually consider replacing that joint, not with a metal implant that you might think of as in hips and knees, but we actually take out the bone that has the arthritis in it. We actually borrow a tendon from your own wrist and weave that around to suspend the joint, and then we ball it up to create a new cushion for that joint. It works very well to alleviate pain and improve their range of motion and function of that hand.